nervous system. I already told you in time of my lecture. Reflex arc. Two diagrams, what you need to draw next time, that is sympathetic and parasympathetic reflex arc. That is spinal cord. First of all, somatic reflex arc. This is posterior root with ganglion, anterior root of the spinal nerve, and here it is receptors in tissues. First sensory neuron, that is what? Yes, pseudounipolar in spinal ganglion. Internuncial in posterior horn, and motor neurons in anterior horn. That is third neuron, and that is motor fibers goes to striated muscles. That is striated muscle. And now autonomic reflex arc. That is spinal posterior root with spinal ganglion, anterior root, trunk of the spinal nerve, and spinal nerve gives ramus dorsalis, ramus ventralis, ramus communicans albus, and ramus communicans grigius. And if we speak about first sensory neuron, it is the same like in somatic. And yes, and second neuron, it is in nucleus, help me, intermedio lateralis. That is second neuron, nucleus intermedio lateralis, in segments from C8 to L3, sometimes 2 is L3. And from here start preganglionic fibers. These fibers passes through anterior root, trunk of the spinal nerve, then rami communicans albi, and goes to ganglion. And here it is third neuron, motor neuron in ganglion. This ganglion is ganglion of the first order, or another name, paravertebral ganglion, or it is ganglion of sympathetic trunk. From this ganglion, postganglionic fibers, one way for postganglionic, goes to somatic nerve and continues with this nerve. Why? And what is it supplies? It supplies smooth muscles where somatic nerve supplies smooth muscles where. Oh, what is this nerve? Rami dorsalis, rami ventralis. Rami ventralis, most of them makes plexus, cervical, brachial, lumbar, sacral, yes? And where we have smooth muscles, for example, in extremity, where? In vessels, yes, we have. Smooth muscles we have in skin. We have smooth glands, sweet glands, for example, in skin. That is sympathetic nervous system. It supplies vessels and glands in skin. That is somatic part of sympathetic nervous system. And another postganglionic fibers goes to inner organs and supplies inner organs. That is stomach, for example. And in organs of abdominal cavity and organs of true pelvis, sympathetic nervous system has some fibers which not interrupt in ganglion of the first order. They passes through this ganglion and goes to ganglion of the second order. It is ganglion prevertebralis or ganglion intermedius. And in this case, third neuron is in this ganglion. And from here, postganglionic fibers goes to inner organ. Clear? And a receptor, it is receptor in stomach, and sensory fibers with these nerves goes to sympathetic trunk, then goes to spinal nerve through rami communicans albi, and goes to posterior root where we have
pseudounipolar neurons.
That is why white communicans branch, it has preganglionic sympathetic and sensory fibers, which goes back to the spinal nerve. Clear? Now, that is sympathetic. And what is the differences between somatic and sympathetic? In somatic nervous system, third neuron in anterior horn and third neuron in autonomic ganglions. In sympathetic, they are ganglions of the first or ganglions of the second order. First order paravertebral, second order prevertebral. First order ganglions of sympathetic trunk, second order ganglia intermedia in autonomic plexus. In synapses of this ganglion, mediator. Do you know what is a mediator? That is, it's participate in conduction of impulses.
Yeah.
Here and here, acetylcholine everywhere, but in synapses between motor neuron and inner organ, here in these synapses, sympathetic nervous system has mediator, adrenaline, or epinephrine and norepinephrine. Now parasympathetic reflex arc. Parasympathetic. Where in spinal cord we have parasympathetic nucleus.
And like from cervical.
Spinal cord
S1 and S4
S2 to
S2 to
S4.
S4.
And what is the name?
Nucleus parasympatheticus sacralis.
Yes, you're right. If it is S2 to S4, this is sacral nerves, dorsal branch, ventral, and ventral branches of sacral nerves makes what? Sacral
Plexus.
What is the largest nerve in sacral plexus? Nervus ischiadicus. This is nucleus parasympathicus sacralis. And here it is sensory pseudounipolar neuron, and it goes to nucleus parasympathicus sacralis. This is first, here it is second, and axon of this neuron passes through anterior root, spinal nerve, then rami ventralis, goes to sacral plexus, and if you remember which nerves start from sacral plexus and goes to inner organs.
celiac, ramis,
Splanchnici. Pelvini.
They are splanchnic pelvic nerves. Then they goes to inner organs. This is urinary bladder, it into pelvis. And these preganglionic fibers goes to inner organs and near of inner organ or inside, it's maybe inside of inner organ. It interrupts and postganglionic fibers supplies inner organ. And in parasympathetic nervous system, acetylcholine is everywhere, in ganglion, in synapses here, and in synapses between motor fibers of motor neuron and inner organ. Acetylcholine is here and here. In sympathetic nervous system, acetylcholine in ganglions, but in motor neuron here, in organs, it is epinephrine and norepinephrine. And sensory fibers, the same here are present, receptor, sensory fibers with splanchnic nerves, with sacral plexus, with ventral branch, spinal nerve, and first sensory neuron in spinal ganglion. First neuron, second neuron, and motor neuron in ganglion. This ganglion is ganglion of the third order. Here it is first and second order. This is third order. And this ganglion is ganglion terminalia, terminal ganglion, in parasympathetic nervous system. And only these two diagrams necessary to draw, only them. My next diagram is only for your understanding. I already said in my lecture that that in ganglions, in each of these ganglions, here and here, we have three types of Dodgel's cells. First type, that is this motor neuron or this motor neuron. Yes, you started in histology. Yes. First type of Dodgel cells, it is motor neuron. This is motor neuron like this, and motor neuron supplies inner organ. That is first type of Dodgel cells. The same here, we have Dodgel cells of the second and third type, yes? And third.
Yeah.
Second and third. Second is sensor neuron. It receives impulses from receptors in inner organ, and it sends impulses to Dodgel cells of the third type, and third goes to first. And we receive peripheral reflex arc. From receptors, impulses goes to Dodgel cells of the second, then third, and then first, and first type supplies inner organ. That is why in autonomic nervous system we speak also about peripheral reflex arc, and this, they are central reflex arches, parasympathetic and sympathetic, and necessary to draw only central. Now we continue to speak about sympathetic nervous system, sympathetic. But before this is
Foramen
magnum,
magnum,
spinal cord, medulla oblongata, pons, here midbrain. In midbrain, we have one parasympathetic nucleus. It is nucleus
accessorius,
and fibers of this nucleus makes ocular,
Third,
continues into third cranial nerve, oculomotor. In pons, we have nucleus salivatorius
superior,
and from this nucleus axons goes to
the seventh facial nerve.
The same in pons, in medulla oblongata, nucleus
Salivatorius inferior,
which continues into
ninth
glossopharyngeal. And the same in medulla oblongata, we have nucleus dorsalis nervi vagi, and vagus nerve.
10th.
Yes, 10th nerve start from this nucleus. And parasympathetic nucleus, we already said, it is in sacral segments, from S2 to
S4.
S4. And here it is sacral nerves, here and here, they are sacral nerves. And these nerves receive parasympathetic fibers, which passes with sacral spinal nerves and continues to sacral plexus, if you remember. Yes, here it is sacral plexus, and from plexus parasympathetic fibers goes to inner organs in true pelvis. Yes, that is nervis plantnice pelvini. Nervis plantnice pelvini. They are parasympathetic nuclei, and this parasympathetic nuclei makes three centers. Mesencephalic center, it has only one nucleus, accessorius. Bulbar center, it has three nuclei, salivatorius superior, inferior, and dorsalis nervi vagi. And third is sacral center. Sacral in segments from S2 to S4, nucleus parasympathicus sacralis. Three parasympathetic centers and one sympathetic center. This sympathetic center has nucleus intermedio lateralis nucleus intermedio lateralis where?
Yeah, here.
From C8, I put here
To L3.
C8
To L3.
L3. And this is spinal nerves, for example. First cervical, second, I will not draw all 31 centers, only some of them. They are thoracic nerves, thoracic spinal nerves, then lumbar spinal nerves, and here the same. And
Sacral.
sacral. And now, we said that these nerves has preganglionic sympathetic fibers, yes? I will draw here. This is preganglionic fibers in anterior root, then in spinal nerve, then it leaves spinal nerve and goes to what? Ganglion of the first order. Ganglion of sympathetic trunk, yes? It is not difficult, I think. It is clear. That is ganglions of sympathetic trunk. And this is sympathetic trunk. And sympathetic trunk consists of 3 cervical ganglions, superior cervical, middle cervical, inferior cervical. Then 11th on 12 or 12th thoracic, then 4, sometimes 5 lumbar ganglions, and 4 sacral, and 1, in your textbook it is coccygeal, but in your classification that is unpaired, impar ganglion, impar, unpaired ganglion. And the same in opposite side. 1, 2, 3 cervical, 11 or 12 thoracic, 4 or 5 lumbar, and usually 4
in sacral.
And now it is clear how these ganglions, thoracic and lumbar, upper lumbar, how they receive preganglionic fibers. What about these 3 cervical, lower lumbar, and sacral, and this unpaired? How they receive preganglionic fibers? They receive them from, for example, these preganglionic fibers which goes to upper thoracic ganglions, some of them interrupts here and continues to inner organ. And some fibers goes to inferior cervical and interrupts here. And other fibers goes to medial cervical. And some fibers goes to superior cervical. And we will see what we can see, that all ganglions join together with the help of interganglionar fibers, rami interganglionaris. They join together all ganglions of sympathetic trunk, all of them. That is why upper lumbar receives preganglionic fibers from upper lumbar nerves, and some of them goes to lower lumbar ganglions, another goes to sacral ganglions, and some fibers goes to this one unpaired or coccygeal ganglion. All ganglions join together with rami interganglionaris, and in sacral and in lumbar department the same. These ganglions join together with transverse fibers. I will not draw a lot here, but you need to remember that in transverse directions the same we have communications between these ganglions in sacral and lumbar department. And now that is most important thing. If it is necessary to prepare which nerves start from sympathetic trunk and goes to inner organs. That is most difficult. That is a lot of nerves which start from sympathetic trunk and continues to inner organs. For example, innervation of some organs on the head. This is eye. This is eye. You know that eye receive parasympathetic fibers from what?
Radix oculomotory and
ganglion
ciliaris
and then nervus ciliaris
brevis
which
will supply sphincter pupillae and ciliaris muscle.
That is parasympathetic. How sympathetic innervation goes to eye? Beginning, that is in nucleus intermedio-lateralis of thoracolumbar center. This is thoracolumbar center. From this nucleus, preganglionic fibers passes with anterior root, then with spinal nerves, then rami communicans albi, goes to superior thoracic ganglions of sympathetic trunk, and from here goes upward through rami interganglionalis and comes to superior cervical ganglion. From this ganglion start postganglionic fibers. And how postganglionic fibers goes to eyeball? Here it is, we have common carotid artery, and this common artery subdivides into internal and
External carotid.
Internal carotid artery goes into carotid canal, then it continues into skull and gives ophthalmic artery. Do you remember?
Yes.
Ophthalmic artery. And now, from superior cervical ganglion, we have nervus caroticus internus. This nerve goes to this artery and makes here plexus caroticus internus. This plexus together with artery, if you remember, internal carotid artery comes to carotid canal. This is apertura externa, then apertura interna, and goes to skull through foramen lacerum and comes to sella turcica. And here we have which sinus? Venous sinus.
Sinus cavernosus.
That is why plexus caroticus internus makes plexus cavernosus, and plexus cavernosus then continues into plexus ophthalmicus, and ophthalmic plexus, it gives to this ganglion radix sympathicus. This radix sympathicus passes through ganglion ciliare and together with nervus ciliaris brevis goes to eyeball, and here it supplies musculus dilatator, dilator. Musculus dilatator pupillae, dilator muscle of pupil. Clear? That is sympathetic innervation of eye. If we speak about sympathetic innervation of lacrimal gland, ophthalmic artery gives arteria lacrimalis, and plexus ophthalmicus continues into plexus lacrimalis and goes to lacrimal gland. If we speak about innervation of nasal cavity, here it is nasal cavity. If you remember, this is pteryga palatine fossa. Pteryga palatine fossa. In pteryga palatine fossa, we remember that seventh nerve. It gives chorda tympani and another nervus petrosus major. It goes to ganglion pteryga palatinum and goes to rami nasalis posterior and supplies nasal cavity. That is parasympathetic now. And now sympathetic. We start from nucleus intermedio-lateralis of thoracolumbar center, preganglionic fibers with anterior root, trunk of the spinal nerve, rami communicans albi, then rami interganglionalis, goes to superior cervical ganglion. Here motor neuron and postganglionic fibers with nervus caroticus internus, plexus caroticus internus, and this plexus gives nervus petrosus profundus, and deep petrosal nerve comes to canalis pterygoidus, and together with greater petrosal nerve, together they makes nervus canalis pterygoidae. This nerve consists of parasympathetic and sympathetic, but parasympathetic preganglionic fibers and sympathetic what? Postganglionic fibers. That is why sympathetic fibers passes through this ganglion and continues with rami nasalis posterior and supplies nasal cavity. Clear? If we speak about innervation of parotid gland, here it is parotid gland. From superior cervical ganglion, postganglionic fibers goes to nervus caroticus externus, and together with plexus caroticus externus, and this plexus, if you remember, external carotid artery gives arteria temporalis superficialis, and this superficial temporal artery passes through parotid gland. That is why plexus caroticus externus, then plexus temporalis superficialis goes to parotid gland. Or from external carotid artery we have lingual nerve, that is plexus caroticus externus, then plexus lingualis goes to sublingual gland, or submandibular, the same. From lingual artery, together with lingual artery, we have plexus lingualis, and then goes to sublingual and submandibular gland.
Okay.
What else? For example, on the neck, this is larynx, and behind of larynx, this is pharynx. And pharynx continues into esophagus. And in thoracic cage, this is heart. That is heart. And now, from superior cervical ganglion, postganglionic fibers goes to larynx and pharynx with nervi, laryngopharyngeal nerves. And these nerves goes to laryngeal plexus and pharyngeal plexus and supply them. Then superior cervical ganglion gives nervus cardiacus cervicalis superior. From middle cervical ganglion, nervus cardiacus cervicalis medius.
Okay.
From inferior, nervus
Cardiacus cervicalis inferior.
And from thoracic ganglions,
Thoracici.
nervi cardiaci thoracici. Do you remember in vagus nerve? It was rami. In vagus, ramus cardiacus cervicalis superior and inferior. And rami cardiaci thoracici. They are parasympathetic, and here sympathetic. And these sympathetic nerves goes to two cardiac plexus. We have plexus cardiacus superficial, and plexus cardiacus profundus, superficial and deep cardiac plexus. In superficial plexus, only one nerve, superior, and only on the left side. All another cardiac nerves goes to deep cardiac plexus, and from this cardiac plexus start plexus coronarius dexter and plexus coronarius sinister, together with coronary arteries. And from coronary plexus continues to heart and supplies it. Clear? No, it is only beginning.
Oh my God.
How many times? We have 3 minutes, yes?
Yeah.
Or not?
Maybe.
No, we have half
No,
an
we
hour.
have
40 minutes. 30
Half
minutes.
hour, yes. 1:45.
Oh, okay, it is good. Well, cervical nerve first, and cervical nerves have not got wide communicans branches. Yes, rami communicans albi here are absent because here is absent nucleus. Yes, but superior cervical ganglion gives gray communicans branch, rami communicans grizzly, which attach to first cervical nerve and second and third and fourth. That is, from superior ganglion we have rami communicans grizzly for spinal nerves from first till fourth. From middle ganglion, ganglion cervicalis medius, it gives rami communicans grizzly for C5 and 6. And from inferior ganglion, rami communicans grizzly goes to C7 and 8
Okay.
and all this thoracic and upper lumbar has both a white and gray communicans branch, like here, white and gray communicans branch. And lumbar and sacral nerves, the same, receive rami communicans grizzly from corresponding ganglions of sympathetic trunk. It is clear rami communicans grizzly present in all 31 nerves. What else? Thoracic ganglions, thoracic and upper lumbar. They give splanchnic nerves. For example, the thoracic nerves from T5 till T9, from 5th to 9th, thoracic nerves. Rami communicans albi goes to the same ganglions, and from these ganglions start greater splanchnic nerve, nervus splanchnicus major. This nerve, nervus splanchnicus major, it consists of postganglionic fibers which start from sympathetic trunk and preganglionic fibers which goes to ganglions of the second order. That is why here postganglionic fibers and preganglionic fibers the same is here, and these preganglionic fibers goes to ganglions of the second order. This ganglion is ganglion of celiac plexus. This is we have right and left celiac ganglion. Next, that is greater splanchnic nerve, nervus splanchnicus major. Then, from 10th and 11th ganglions, 10th and 11th thoracic ganglions, we have lesser splanchnic nerve, nervus splanchnicus minor. It also consists of post and preganglionic fibers. And goes to another ganglion. This is, it was celiac ganglion. We have right and left celiac ganglion from opposite side. We have aortorenal ganglion, ganglion aortorenalis, the same, right and left. And we have superior mesenteric ganglion, and it receives from upper lumbar ganglions. From upper lumbar we have nervi splanchnici lumbalis. Nervi splanchnici lumbalis. They also consist of pre- and postganglionic fibers, and preganglionic goes to superior mesenteric ganglion. It is nervus splanchnicus minor, and it is nervus splanchnici lumbalis. And we receive here it is celiac plexus. Next time we will speak a lot. Today only these nerves and ganglions you need to know. That is plexus celiac plexus. Then, what else in abdominal cavity? Celiac plexus continues into aorta abdominal plexus, plexus aortica abdominalis, and this plexus has another ganglion. It is inferior mesenteric. It was superior mesenteric in celiac plexus. And inferior mesenteric ganglion in
Aorta.
aorta abdominal, and from
abdominal.
here continues inferior mesenteric plexus.
Okay.
And these ganglions, the same, receive nervi splanchnici lumbalis,
lumbalis.
like this. This is from superior lumbar ganglions, and from inferior
Inferior
ganglions start nervi splanchnici lumbalis, which also goes to this inferior mesenteric ganglion. And last plexus, large plexus, we have in pelvis. This is plexus pelvinus.
Pelvinus.
And plexus pelvinus receive nervi
Splanchnici
splanchnici
pelvini.
pelvini. They are parasympathetic. They passes through this plexus and continues to inner organs, and only here it is. It has ganglion terminale. Ganglion terminale, yes?
Yeah.
And supplies inner organs in true pelvis. And from these sacral ganglions of sympathetic trunk, we have nervi splanchnici sacralis. Nervi splanchnici sacralis. And here we have ganglion intermedia. These ganglions have not got specific name. In abdominal cavity we have celiac, aorta renal, superior mesenteric, inferior mesenteric. In true pelvis it have not got specific name, just ganglion intermedia. All of them ganglion intermedia. And from these ganglions, postganglionic fibers goes to inner organs and supplies. Oh, this is almost.
Almost.
Some nerves I not tell you. For example, nervus from superior cervical ganglion, we have jugular nerve, which together with internal jugular vein goes to posterior cranial fossa. Some another small nerves, nervi bronchialis goes to plexus pulmonalis and supplies lungs. But main nerves, we discuss. And next time I will ask you sympathetic innervation of all organs above of diaphragm. Above of diaphragm. In abdominal cavity and in true pelvis, next time we discuss. But you will answer innervation of organs above of diaphragm. Oh, for example, innervation of heart.
Yeah.
We start from nucleus intermedio lateralis of thoracolumbar center. From here, preganglionic fibers with anterior root, trunk of the spinal nerves, goes to sympathetic trunk and interrupts here. Postganglionic fibers, and some fibers goes to inferior cervical, another to medial cervical, and some fibers goes to superior cervical and interrupts here. And from these three cervical and upper thoracic ganglions, we have nervus cardiacus cervicalis superior, medius, inferior, and nervi cardiaci thoracici. They goes to two cardiac plexus, superficial and deep,
profundus.
and from them continues into plexus coronarius, dexter and sinister, and supplies heart. And you need to know what sympathetic nervous system makes with organs. Heartbeat increase, blood pressure the same. What happened with pupils?
Dilation.
In bronchi, it's dilation bronchi. Salivary glands, it inhibit function. Sympathetic inhibit, parasympathetic stimulates. Not only salivary glands, but all digestive glands, pancreas, gastric glands, liver, all digestive glands, parasympathetic stimulates, and sympathetic nervous system inhibiting functions. Okay. Give me your textbook. Thank you. General information, classification, central, peripheral, centers. I said that these mesencephalic, bulbar, thoracolumbar, and sacral, they are segmentary centers. They are specific. Some of them parasympathetic and one sympathetic. And we have suprasegmentary centers. They are not specific. They supplies both sympathetic and parasympathetic. And suprasegmentary centers are, what is it? Cerebellum, hypothalamus, limbic system, reticular formation, and brain cortex. They are suprasegmentary centers. It also here describes suprasegmentary and segmentary. Then reflex arc, Dodgel's cells, ganglions of the first, second, and third order. First and second in sympathetic, third order in parasympathetic. Differences between somatic and autonomic. Differences between sympathetic and parasympathetic. And then sympathetic part of autonomic nervous system and sympathetic trunk. And here it is, you will see what start from cervical, superior cervical ganglion, then that is superior cervical ganglion, then here it is, should be medial cervical ganglion, inferior cervical, then thoracic ganglion, then lumbar and sacral, till prevertebral ganglion and autonomic plexus. Plexus not necessary, till page 385.
Okay.